Hello everyone, welcome to week 8 of your pharmacy software course. This week we're going to be completing labs 15 and 16, so we're actually finishing up the institutional setting and then moving on to some of the reports and things. So in the first lab that you're going to be completing, lab 15, we're going to be looking at entering chemotherapy orders. So this is specifically intravenous chemotherapy. Not all the chemotherapy is intravenous, but many times when we think of chemotherapy, we do think of the IV therapy. A lot of times these infusions are done in a hospital, but they can also be done in other different types of outpatient settings, in a doctor's office, in a clinic, things like that. The difference between these types of orders and traditional orders for medications are going to be mainly that the medication is going to be based on the patient's weight. And, especially keeping in mind that that patient's weight is likely going to change significantly over the course of their chemotherapy treatments, we'll want to make sure that we're calculating that properly every time. Chemotherapy treatments are frequently adjusted, so that's something that we typically have to do on a regular basis. In other words, calculating the new dosages and things like that. A lot of times, the order will originally be written while the patient's in a hospital, but then once they're out of the hospital and they're getting their outpatient chemotherapy treatments, it will frequently change. In addition to seeing the instructions for chemotherapy itself, you're also going to see other things on the order. So if you look at some of the orders in the back of your textbook, so if we go to Appendix E as an elephant, which starts on page 166, you will see that this particular chemotherapy order on page 166 and 167 is 2 pages long. You can see that it includes not only the patient's weight, diagnosis, birth date, that type of thing, but you can see what the actual chemotherapy drug is, and then some of the parameters. In other words, sometimes chemotherapy can't be given if the platelet count's too low. You're also going to see things on the second page about the pre-med and other things. So there's going to be things for possibly nausea and vomiting, some sort of anti-anxiety medication. Some of those things are also included in the actual chemotherapy order. So keep that in mind, that it's not going to necessarily be strictly the drug. Now back to our lab this week on page 110. This is going to be just you creating a basic chemo order. So you're going to be just putting the drug in a solution, a base, in this case normal saline, in order to infuse it. So they're going to walk you through the steps in order to set that up. Keep in mind that you're going to be taking screenshots at specific times. Make sure you read through the instructions for the assignment so that you know how and when to do that. Now the second lab that you're going to be completing this week is lab 16. This is where we start looking at reports. So some of the different reports that we can pull and the uses for those particular reports. The first report that you're going to be doing is a controlled drug report. Keeping track of our controlled substances is key in any pharmacy. We must have an exact count of our C2s at all times. C3 through 5, we don't have to have an exact count, but we still do want to keep track of those prescriptions. So this is going to walk you through how to produce those particular types of reports, what to do with those reports, and things like that. This week I'm actually going to have you be doing the exercises as well at the end. So make sure that you are completing those, printing them out to a PDF. If you haven't set your report printer to that cute PDF, make sure that you do so. And also make sure that you are completing all of these assignments before you take your quizzes. A lot of the quiz questions are coming from the assignment, so it's really important that you complete that quiz before you or complete that assignment before you try to complete the quiz. If you have any problems or questions getting some of these things to work, something to print, etc., please make sure that you reach out to me. You can call me, you can email me, you can text me, but just make sure you reach out to me before you just turn something in. And if you have any questions, just let me know, and have a great week.